Hi, I'm Shawn Jones, Process Development Manager here at Arkion Life Sciences, and today I'm going to talk to you about our EGCEL IgY technology platform. Specifically, I'm going to talk to you about our EGTEC-C product formulated for calves and its ability to reduce calf morbidity and mortality. In this presentation, I'm first going to go over what IgY is and how it works, then describe some unique aspects of our EGCEL technology platform. Next, I'm going to go into our in vitro results, showing how the IgY can bind to different pathogens and neutralize them. Then look at antibody specificity and different inputs to the calf, specifically calf milk replacers, plasma or colostrum replacer. Then I'm going to go over 3 calf trials we completed back in 2023. And finally, how we compare to other IgY products on the market. First, 2 quick introductions. First to Michelle Tollefson, our Business and Marketing Director on the EGCEL line. And again, myself, Shawn Jones, Process and Development Manager here at Arkion. I oversee the production and the R&D program on the EGCEL line of products. So what is IgY technology and how does it work? IgY is the avian equivalent of IgG. It's a major antibody found in chickens and is found in both the blood and in the egg yolk. Interestingly, IgY actually provides the newly hatched chick with passive immunity. Obviously, the hen doesn't produce milk as mammals do to give it to the newly hatched chick. Instead, the mother hen deposits all of these IgY into the egg yolk sac. After hatching, the chick absorbs that egg yolk into its body and then slowly releases the IgY into its system to provide passive immunity, very similar to how colostrum is given to calves. So how is our IgY generated? So at Arkion, we formulate our own vaccine using either taking bacteria, viruses, toxins, specific antigens, and we formulate this into a proprietary vaccine and give this to the birds. The birds will then generate antibodies against these pathogens and deposit those antibodies into the yolk of the egg. We then harvest the egg and process that into a whole egg powder. This can also be processed into a yolk powder, a purified IgY solution, or into a liquid egg for different delivery methods. We find the whole egg powder to be the most efficient, but these other platforms are available. So how this works is you feed the calf, you formulate the IgY into the milk replacer or the milk you give into the calf and feed it orally to the calf. The IgY then bathes the GI tract and is there, and if a pathogen is present that it recognizes, it'll bind to that pathogen, neutralize it, and then remove it from the gut through the feces. So all it is going to sit there in the GI tract, recognize pathogens that it's designed to recognize, and remove them. It is not systemic. It is not absorbed by the calf. It does not get into the body of the calf. It stays in the GI tract, and therefore we can treat enteric diseases. We cannot treat respiratory diseases since we don't get into the lung or any of the nasal passages, only in the GI tract. So it's really specifically designed for enteric challenges to the calf. It needs to be continually fed because once it passes out of the GI tract, the antibodies are gone. So you need a constant supply of this to provide the protection it's designed to. Now really this is designed to cover the gap in between the peak of passive immunity and when active immunity is a process. We know from giving colostrum is great for the calf, but there is this waning release of colostrum into the GI tract, of the IgG from the colostrum into the GI tract. Before the active immunity is really geared to deal with these pathogen challenges. So the IgY kind of helps fill this gap and provides the antibodies to the GI tract to reduce the pathogen load while the active immune system is still being built up by the calf. So again, EGCEL is Arkion's proprietary platform of our IgY technology. Currently, we have 3 offerings under the EGCEL brand: EGTEC-C for calves, EGTEC-S for swine, and Active Egg for companion animals. EGTEC-S and EGTEC-C are primarily antibody-based products, where the antibodies are formulated for enteric diseases these animals see. The Active Egg also has IgY against specific pathogens, but that's more for anti-inflammatory effects particularly on older animals, shinier coat, healthier animal overall. This is more for overall health benefits, where the egg tech C and S are more for the antibody support it provides. Some unique aspects of the EGCEL platform. One, we are polyvalent. So what this means is we deal with a host of challenges, particularly for egg tech C. We don't just target E. coli or a salmonella. We target E. coli, rotavirus, coronavirus, BVD1, BVD2, salmonella. We target all the major enteric challenges to, again, cover all the different pathogens the calf may see to reduce its ability to get to get sick. It is a unique proprietary process. We're a whole egg. We're food grade, recognized as GRAS, and made in the U.S. here. We are an egg-focused business. This is our product. We don't make anything else. We don't look at probiotics or essential oils or anything else. We are focused on the egg. We have an active R&D pipeline, and we do have this anti-inflammatory benefits, particularly more for the companion animal side. So next I'm going to go into some in vitro results we see on our IgY product to kind of describe how it can work in the body itself. So the first assay we did is binding to bacterial cells. Specifically, this is E. coli culture. So how this assay works is we take actively growing bacteria, in this case E. coli K99, and our IgY solution. We mix these two together. Antibodies that are specific for that K99 E. coli will bind to that K99. Any IgY that's not specific, we washed away. We then provide a secondary antibody that's specific for that's going to bind to IgY that has a marker onto it. So as more of these bind to the IgY, there's going to be more fluorescence. So the more fluorescence you see, there's more IgY bound to the bacteria. So first we see here IgY, a non-specific IgY. So this is just non-hyperimmunized egg powder you would find in the grocery store or anywhere else, mixed with E. coli. As you can see, there's very little of any fluorescence, meaning there's not any antibodies in that mixture specific for this E. coli strain. On the bottom now here you see increasing amounts of our IgY mixed with the E. coli. So on the left-hand side you see here there is some fluorescence, but not as much as on the right-hand side here. So again, as we add more IgY, more as IgY can bind to the E. coli, you have a brighter fluorescence. As what happens in the gut, the more IgY that can recognize this E. coli, the more it will bind to this E. coli and remove it from the gut and prevent the calf from getting sick. And we've done this on K88, K99, 987P, and F18. And all four of these strains, we can bind them and remove them from the gut. We've also looked at virus neutralization. So this is a little different assay setup than the bacterial setup. So first, we take active virus and mix it with our IgY solution. Now, if the IgY recognizes the virus, it'll bind to it and neutralize it, essentially meaning that it will prevent that virus from being able to invade a susceptible cell, and making it sick. We also have unbound virus. If we don't have enough IgY to fully bind the virus, we're going to have some unbound active virus. And then we have unbound IgY that's not specific for that virus. We then take that entire mixture and apply it to a susceptible cell culture. Again, these two viruses particles that are not bound by either IgY can still invade the cells, and so we see two infected cells in our culture. We then apply a antibody against the virus to this culture, and so that only cells that are infected by the virus are going to fluoresce in this case. So it's a little slightly different from the bacterial assay. In this case, bright fluorescent cells mean they're infected, meaning that we were not able to protect that cell with our IgY. So here we see from the left to the right increasing amounts of IgY. So on the left-hand side, we still see a number of fluorescent cells, meaning they're infected with the rotavirus. As we move to the right and we add more IgY solution, we see there's very few infected cells on the right-hand side, meaning that almost all of the virus has been neutralized and they're not able to infect the cell. And we've done this assay now for rotavirus, coronavirus, BVD1 and BVD2, and we're able to fully neutralize all 4 of those different viruses. Next, we've also looked at the specific antibody profile of different additives for calves. So this kind of came really from talking to a field vet at a conference a few years ago. And he was talking to us about that he was dealing with this rotavirus outbreak in this herd that kept happening. He would talk to his home office, and the home office would tell him that the milk replacer has IgG in it, and that should take care of the rotavirus, and don't worry about it. But clearly, the calves were still getting sick from rotavirus, so the IgG wasn't taking care of it for the calves. And so we kind of asked ourselves this question: can we look at the specific profiles of milk replacer, bovine plasma, other inputs for the calf, and compare it to the egg tech C to see if the egg tech C does have higher antibody profiles than these other products have? So this is what we did. We acquired 5 commercial milk replacers, one from Milk Specialties, one from DFA, Denkovic, Lena Lakes, and Provimi. All these were off the shelf, and these were milk component only. So none of these can contain any plasma in them. And we looked at these 9 different enteric disease challenges: rotavirus, coronavirus, crypto, E. coli, 3 different salmonella, and 2 different clostridium. Again, to see where the specificity of these different inputs and their coverage of these different pathogens to bind them and remove them from the gut. And we did this by ELISA. So how ELISA works is you take your antigen of interest. This could be a bacteria, a virus, or a specific antigen, and you absorb it onto the surface of a 96-fold plate. After it's been absorbed, we then add our antibody of interest labeled with a reporter enzyme, in this case a horseradish peroxidase. So if we apply our antibody, if the antibody has specificity for the antigen, it'll bind to that and then remain on the surface of the plate. If it doesn't have specificity, it'll just get washed away. We then apply a substrate to the plate. That substrate will be converted into a different color by that HRP. We can then read that output of that reduced substrate as the amount. We can then correlate how much fluorescence that is to how much antibodies bound to the plate. So basically, the more response you get, the higher. That means the more of the antibodies bound to the plate, bound to the antigen of interest. So on the milk replacer itself, how we did this was we took the milk replacer, extracted the IgG from it, labeled it with this HRP, and then did the ELISA. And again, we read the output of the ELISA at A450. This is just the absorbance of that reacted substrate. Again, the higher the A450, that means there's more antibody bound to antigen on the plate. So here are the results on those 5 different milk replacers. First one, quick note, we have A through E here. This is randomized compared to the list I showed before. So we're not calling out any specific milk replacer company. We just want to look at milk replacers in general and see what they look like. So it's not correlated to that first table there. So first, on the left-hand side here, you see the total IgG concentrations of the milk replacers. And you see that there's a good range, going from over 12 milligrams per gram in sample E down to 2 milligrams per gram in sample B. Also, on the right-hand side here, you see the specific profiles. And again, you see very varying degrees. Obviously, sample E has the highest titers overall, whereas sample B has the lowest titers overall. So that kind of matches with our total IgY, our IgG concentrations, actually. But there's some inconsistencies. So one, if you look at sample A and sample D, across the board, they have very similar specific titers. But if you look at their total, sample D is about half of sample A. So having a lot of IgG is good, but you really want to make sure you have the specific IgG or the pathogens of interest. Similarly, B and C, C has about double what B has overall for IgG, but if you look at the specificity, it's not that much higher than B. So you need to look at both how much IgG you have, but also the specificity of that IgG. Now the question is, if we add IgY, can we improve these titers? So how we did this was similar to how with a milk replacer, we extracted the IgY from the egg powder, we labeled it with the HRP, and now we've mixed both the IgG and the IgY, applied them to the plate, and so that both antibodies now can now bind to the same antigen and read the total output. So this is the total binding to that one antigen of interest, which would be the pathogen in the gut. So here we see the profiles, and this is the equivalent of adding 2 grams of egg tech C to sample C. So as you remember here, sample C is one of the lower ones on the specificity table. By adding 2 grams of egg tech C, we significantly improve its titer. So now for rotavirus and coronavirus, it's really competing now with sample E, and cryptos is more kind of sample E than it was before. So we took one milk replacer that had a very, very low antibody specificity profile. By adding egg tech C, we really boost that profile and provide the calf a lot more protection. Also look at adding it to sample A. Sample A was one of the higher ones initially, and we improve it. So now sample A is actually beating sample E in rotavirus and cryptosporidium. In other ones, it's much more equivalent to sample E. And even to sample E, we can still improve the titers. Much more kind of on this scale, around for perfringens and salmonella, not as much, but for E. coli and crypto, we can even improve sample E. So really, adding egg tech C to any milk replacer we see, there is a benefit to the antibody profile. It really kind of depends on which one we add to the scale of the improvement. We also looked at bovine plasma. Plasma is a common additive to many milk replacers. It's for its protein content. Also, it has a bunch of IgG as well. So we were curious to see if can egg tech C improve the titers on plasma. So here we simulated a milk replacer with plasma by taking 5% of bovine plasma and comparing that with 5% plasma with 2 grams of egg tech C. And across the board, we do see a statistical increase in the A450 titer with the egg tech C. So even comparing to bovine plasma, which has a lot of IgG, adding the IgY on top of that can still improve titers and provide more of the antibody to remove these pathogens of interest from the gut. We next also looked at colostrum replacers. So unlike the previous examples where we're looking at a dose of milk replacer, this analysis is on a gram per gram basis. So this is a gram of milk replacer versus a gram of egg tech versus a gram of colostrum replacer. So the first you can see here, for all the milk replacers, per gram of milk replacer, they have very, very low specificities for these pathogens of interest. Even sample E that had a fairly high titer for a dose of milk replacer per gram does not have very good titers. Egg tech C and the colostrum replacer actually compared fairly well, particularly for rota, corona, and crypto. Actually, for crypto, we're statistically tied with the colostrum replacer. And we mainly show this mainly because it's recognized more and more now that extended feedings of colostrum or transition milk really benefit the calf long-term health-wise. Egg tech C obviously is not the replacement of a colostrum. There's lots of other things in colostrum that you don't get from egg tech C, but at least from an antibody profile, the egg tech C compares very well to a colostrum. So if you're looking at an extended feeding program with colostrum, an egg tech C may be a nice, cheaper way to have that extended antibody input to the calf to reduce the chance of getting ill. So again, this mainly showed that on a per gram basis, we have very high specificity titers, much more similar to colostrum than any other sample. So all of this is great. So it's supposed to work very well in the lab, but how does it actually work in the field? That's one of the big questions. So we've completed 3 field trials, 2 on bull calves and 1 on heifer calves. So the first study we completed was on bull calves done at Mapleview. It was a total of 240 calves split between 3 different groups. The control was fed 4 grams of egg powder, a non-hyperimmunized egg powder, whereas the two treatment groups was fed 4 grams of egg tech C or 8 grams of egg tech C. So the control in this case was designed mainly to control for any nutritional benefits the egg powder would provide. We really just want to look at what does the specific antibodies do to benefit the calf. So in this case, for the study overall, we did see a decrease in mortality from the control at 7.5 to 4.7 for the higher dose of egg tech C. So again, you see this dose-dependent step decrease in mortality, which is great. But what we really saw interesting was if you pull out a bit more specifically in these groups, half of the calves in the study, 120, were categorized as failure of passive transfer, meaning that their total serum protein was less than 5.2 grams per deciliter. Essentially, these calves did not get enough colostrum early on in life. So again, if they don't get enough colostrum, their passive immunity is lower, so they're more susceptible to disease pressures. So in these calves that did not get enough colostrum, we saw a much larger increase or impact on mortality, from the control at 12.5% down to 2.4% for the higher egg tech. And this was a p-value of 0.08. So again, for a field trial, it's basically statistically significant. And looking at the ROI, so looking at what the egg tech C itself cost and what these calves themselves can sell for, based on the USDA average cost for March of 2004, we see an ROI of 1 to 8 and 1 to 7. So again, this really points to the benefit of egg tech C, just keeping these calves alive, and it's a good return on investment. We did then a second bull calf trial in Pennsylvania. This one was done differently than the first one. First, the control was given no supplement, no additive. So not controlling for anything, just saying the calf isn't going to get any supplement. We then looked at a stepped feeding approach. So for the first 2 weeks, having a higher dosage of egg tech, either 10 grams or 20 grams, and then the next 2 weeks have a lower dose. So go from 10 to 5 or 20 to 10 to see if that initial dose will help remove kind of the pathogens from the gut and keep the calf healthier. We also wanted to see if this 20-gram dose, if we're going to see any negative impacts on the calf. This is 5 times what we were doing before, so we wanted to see if this could have any negative impacts on the calf at all. So we saw up to day 14 was again a step decrease in mortality based on the egg tech dosage. And really actually interesting, a very good R-square value. You can actually do linear regression from this, and at least from this it's saying, if you do 30 grams, we have had no mortality. Obviously that's a regression analysis probably wouldn't really happen, but it's interesting that it is a very linear relationship between the dosage and mortality. Going up to 28 days, the end of the feeding regimen, we see a mortality of 16.7 in the control and 5.7 in the higher dose. One thing to note is that these calves were not given any treatment during the study, so no antibiotics, no electrolytes, only the egg tech C. So this decrease in mortality is just the impact of egg tech C on the calves. And in this case, we saw a return of 1 to 3 and 1 to 5. It's really interesting that in this 20 to 10 case, we spend a lot on the egg tech because of the very high dosages, but because of the reduction in mortality, we still get a very favorable ROI on that. So again, this really highlights the ability of the egg tech C to reduce that pathogen load and keep these bull calves alive. So kind of going into it, the study questions was, does a stepped approach work? Yes, it worked very well. Are there any negative impacts from 20 grams of egg tech C? No. Like I said, if anything, the 2010 regimen did better than the 10-5 regimen. Finally, we had a Heifer study in New York. So this was conducted on a working dairy in upstate New York. Calves were enrolled on a rolling basis from late October to late November. This was done similar to the first one, where the control was fed egg powder, a non-hyperimmunized egg powder, and we tested the 4 and 8 gram levels. A total of 142 calves were enrolled. The main impact we saw here was on scouring. Since this was a working dairy, the mortality was very, very low. I think only 3 calves died the entire time. Again, this is a working dairy, so these are the money makers for the dairy, so they want to keep all the calves alive. But like I said, the main impact we saw was on the scouring scores. So this was scored from 0, normal, up to 3 to a watery stool. And these scores were made by the same farm technician, so there's no bias in the scoring. It's done by the same person throughout the whole study. So what we saw was a decrease in the number of days of scours, just any scours at all, from 4.7 days in the control down to 4 or 4.1 in both treatment groups. Of severe scours, so this is a score of over 1, so this is where the calves are really, it's a very watery feces. Again, this is about a day and a half in the control, down to just over a day in the higher egg tech treatment. And also the severity of scours is less with the egg tech C. And with the severity score, we're just summing all of the different scour scores over the entire study period. You can see here, p-values are still less than 0.1. So again, for field work, this is pretty much significant results. The final thing we saw, we also looked at the number of treatments the calves needed. So calves needing 1 or 2 treatments, meaning that they either needed an electrolyte, they needed an antibiotic, something where a technician had to go out into the field and give the calf something to keep it healthy. Interesting, so about half the calves in the control needed none or 1 treatment, and just under half needed 2 or more treatments. But in both of our AgTech C treatments, only 30 or less % of the calves needed 2 or more treatments. So again, you're saving money not only from the treatment itself, but that person going into the field, seeing the calf, giving them this thing, following up with the calf, making sure that they need another treatment or not. You're saving money in that regard, and the calves are staying healthier longer. So again, we're seeing a good impact on the AgTech C in just calf health. So based on all of these studies, this is our current dose recommendation chart. If you are using an in-bag milk replacer, this is where the AgTech C is already formulated into it. We would say 4 to 8 grams daily is kind of the maintenance dose. Now, if you're adding this into your milk replacer, again, we would say a 4-gram daily dose. This is 2 grams in each feeding, would be the minimum kind of maintenance dose. For heifer calves during severe challenges, we would recommend a higher dosage, again, to kind of decrease that load, but you only need that probably for a week or 2, and then you can reduce that to the maintenance level. Similar with bull calves, if they are FDPI calves or if they are in a severe challenge, we would recommend, again, this higher dose initially and backing off to a maintenance dose after that. Finally, we have looked at other IgY products in the market. We're not the only ones. We wanted to see how we compare to other ones on the market. So far, we've been able to acquire 5 different competitive products from product A to product C, compared to whole egg. So whole egg, again, is just non-hyperimmunized egg, just what the whole egg would look like. And specificity-wise, we compare very well. So for Rhoda, Corona, and Crypto, we have the highest titers across the board. Same thing with E. coli, the highest titers compared to any other IgY product. For Dublin and Heidelberg Salmonellas, product A does have higher titers, so we are working on improving those titers for us. But for Typhimurium, we do have higher titers than product A. And really across the board, if you look at that, even compared to product A, we do have compared very favorably. So if you have another IgY product you would like us to test, we'd be happy to take a sample and to test it to see if it's one of these products or if it's a different product. But again, we feel very confident in our product, so if you want to compare it, we offer that service. So just in summary, AgTech C is an oral treatment given with the milk or milk replacer to calves. The IgY in the AgTech C will recognize and bind pathogens in the GI tract and remove them. So really, you're just reducing that disease load on the calf so it doesn't get sick. And what we've seen so far in on-farm trials is reduced mortality in bull calves in a dose-dependent manner. Basically, the more AgTech you feed, the lower mortality we've seen so far. And reducing the morbidity in heifers. Again, the more AgTech C has been fed, we see lower incidences of scours. And finally, once kind of as a from all the antibody specificity testing we did, talking to the different milk replacer companies, we realized that there is a demand for this testing, and the companies and producers may be interested in seeing, what am I feeding my calf? Does it have enough antibodies, and is the profile sufficient for them? Or if you're a formulator, different whey protein inputs may have different amounts of IgG or different specificities of IgG. So this would be a way for you to submit samples, and then they'll be analyzed as a service, and you'll be given the profile back. That will be done through BTR, which is a research lab under the Arkion umbrella. We're currently this service is currently in development. We're kind of finalizing the assays, making sure we're comfortable with how they operate, the different inputs that will be given. So looking to hopefully launch this Q3 of 2024, but we'll update this as we progress. So thank you for taking your time to listen to this. Hope it was educational. Feel free to check out our website at EGCEL-0524-06 for more information, or actually to place orders on there as well. So thank you again. Bye.